All right, let's just jump right in. If you're a pharmacy student, you know exactly what it feels like. That pressure is always on, right? You've got this mountain of information to get through, and those big exams are, well, they're always just looming. But hey, don't sweat it. We're going to break this all down and make it super clear. So whether you're a P2 or a P3, that high-stakes exam is the thing standing in your way. But this explainer, it's all about giving you the framework to walk into that test feeling confident. We're going to cut right through the noise and focus on the core ideas you absolutely have to know. And to make it really simple, really memorable, we've boiled everything down to two fundamental pillars. Seriously, if you can get a solid grip on these two concepts, you're not just studying for a test, you're actually building the foundation for your entire career. So, ready to see what they are? Let's start with pillar one, the rules of the game. I mean, think about it. Before you can even begin to fill a prescription, you have to understand the legal framework that says who's allowed to do what. This stuff is completely non-negotiable, both for your exam and for real-world practice. It all begins with something called licensure. The best way to think of this is like your own personal, professional passport. It's given to you, the individual person, after you've jumped through all the hoops. Education, exams, you know the drill. And here's the really important part. Once you've earned it, it's yours for life. Unless, of course, you do something serious to get it revoked. Okay, now here is a classic spot where students get tripped up. Licensure versus registration. Listen, they are not the same thing, and you've got to know the difference. Here's a super simple way to remember it. People are licensed. That's you, the pharmacist, the individual professional. Places are registered. That's the actual pharmacy, the building, the establishment. And hey, that's also why technicians are registered, not licensed. Getting this straight? That's an easy point on your exam you don't want to miss. The next big rule you need to know is scope of practice. This is just a legal term that defines the boundaries for a profession. It's basically the official list of what someone is allowed to do and, just as importantly, what they're not allowed to do. So, for example, the scope for medicine is huge. They can diagnose, treat, operate, and prescribe for pretty much any human condition out there. And this leads to maybe the most critical point about scope of practice. It's kind of a zero-sum game. Once a specific activity, like prescribing medicine, is legally put into one profession's scope, everybody else is legally blocked or precluded from doing it. This is what creates those very clear, distinct professional lanes. So, if scope of practice creates these separate lanes, let's get down to brass tacks and look at the actual professional lineup. For your exam, you absolutely have to know who's driving in which lane and, more importantly, where their off-ramps are. What are their limitations? Now, a physician's authority is wide open with basically no limitations. But check out the others. A dentist? Sure, they can prescribe, but only for things related to dental health. A veterinarian can prescribe, but only for animals. A podiatrist? You guessed it, only for the foot and ankle. And notice this, registered nurses can't prescribe on their own, but physician assistants can, as long as they're supervised by an MD. Nailing down these little details means easy points on your test. And here it is, the classic exam trap question. Psychiatrists versus psychologists. Just burn this into your brain. Psychiatrists are physicians. They're MDs. They went to medical school, so yes, they can prescribe medication. Psychologists, on the other hand, are not physicians. Their expertise is in therapy and counseling, so they cannot prescribe. You have got to know this one cold. Okay, so that was pillar one, all about understanding the rules. Now, let's move to pillar two, your critical task. This is where all that legal theory smacks right into your daily reality. This is all about what you actually do every day as that final checkpoint for patient safety. You know, the job of a pharmacist has changed so much. The old days of just count, pour, lick, and stick are long gone. Today, your main job, your most important function is verification. You're the expert in the room who's responsible for double-checking everything and everyone, the technicians, the technology, to make sure every single prescription that goes out the door is 100% correct and legal. So how do you actually do that without ever missing a single detail? You use a system, every single time. This isn't just a random list, it's a mental checklist you should burn into your workflow to protect yourself and your patient. It's 4 simple steps. 1. Verify the prescriber. 2. Verify the patient and the drug. 3. Verify the directions and the labeling. And 4. Verify all the legal stuff, like refills. And when we get to step 3 on that checklist, verifying the label, there are some very specific rules you just have to memorize. For instance, New York law has what it calls critical elements. Think of them like the big three: the patient's name, the drug name and strength, and the directions for use. All of those, they have to be in at least a 12-point font. And, this is key, nothing else on that label can be bigger or bolder. I can pretty much guarantee you're going to see a question on this. And for step 4, especially when you're dealing with controlled substances, the rules get even more strict, and there's just no wiggle room. The first fill has to happen within 30 days of the date it was written. The entire prescription is only good for 6 months total. The quantity has to be written out in both numerals and words, and it absolutely must state the maximum daily dose. These are the kinds of details you just have to know.
So we've got the rules of the game from Pillar 1, and we've got your critical task from Pillar 2. Now let's connect them. Let's see how they work together in the real world. This is where knowing the rules actually becomes your power.
All right, let's try a quick little exam-style scenario. A prescription for amoxicillin comes in for a patient named John Smith. You glance down at the prescriber, and it's Dr. Davis, DVM, a veterinarian. Red flag. What's the issue here? The answer is really simple. That prescription is invalid. And why? Because Pillar 1, the rules of the game, already taught us that a veterinarian's scope of practice is limited to animals. Your critical task of verification always starts with making sure the prescriber even has the authority to write that script in the first place. Okay, let's do one more. This time, a dentist writes a prescription for an antidepressant. The note says the patient seemed a little down during their annual cleaning. Is this a valid prescription? And again, the answer is a hard no. It's invalid. Sure, a dentist can prescribe things like an antibiotic for a nasty tooth infection or maybe some pain meds after a root canal, but treating depression has absolutely nothing to do with dentistry. It falls completely outside their legal scope of practice. And you, as the pharmacist, are the one who has to catch that. Look, this is about more than just checking boxes to pass a test. This is about truly understanding the enormous responsibility that's about to be put on your shoulders when you become a licensed professional. And I really want to leave you with this warning, which comes straight from the source material. Being imprecise is just as bad as being wrong. You will lose points on an exam for flagging things as errors when they aren't actually legal errors. That's why you have to know the difference between what the law actually says versus what might just be a company's internal policy. Your job is to enforce the law. So in the end, it really all comes down to these 2 pillars: understanding the rules of the game and mastering your critical task of verification. That's it. That's everything. This is what makes you the final, trusted guardian of your patient's safety. So yeah, this is about passing the exam. But the real question, the one that's going to define your career, is how are you going to apply this knowledge, this responsibility every single day?